One in 8 people who battled COVID will develop long COVID, with symptoms persisting as long as 2 years after first becoming sick. The U.S. government estimates there may be as 23 many as 23 million long COVID patients in the U.S. alone. Some of the most common symptoms include pain and difficulty breathing, and many patients also report cognitive problems. But now there is an experimental treatment to target brain fog. CNN chief medical correspondent Dr. Sanjay Gupta reports.
I went home on oxygen for 500 days.
Wow.
I had physical therapy. I had a nurse who came every day.
Was there a point when you said, okay, these symptoms are not going away?
Yes. 4 weeks after I left the hospital, I couldn't understand why I still felt so bad, why everything hurt. I was on a walker. I was crying. My PCP had in my hand and she said, "Barbara, you have long COVID."
That was September 2020. Barbara Van Meter Niven's life was turned upside down. 14 years as a retail manager, leading and coaching a staff of more than 20, was no more. Now exchanged for a life of alarms, reminders, and pills.
I have this list. Alarms is that for things that I need to do daily.
In the years to come, there will be textbooks written about long COVID.
Do my vitals.
But what is increasingly clear now is that for too many people, the symptoms come and then they stay, persisting for weeks, months, and for Barbara, even years.
I feel like there's a virus in my brain and it's changing things in my brain because I can't think, I can't remember.
One of the first things that I noticed was that people were complaining of really striking cognitive problems.
Often called brain fog. However, that is elusive, hard to define. But as psychologist James Jackson started to see more of these patients, he also saw something more specific, something so-called brain fog patients seemed to share in common. They had lost the ability to attend, to simply pay attention.
With other chronic illnesses, the cognitive deficits we see seem to focus on attentional problems, problems with processing speed, often memory complaints, but when you dig down, you find that really the problem is attention. That they're not attending, and functionally they experience that as a deficit in memory.
With that in mind, he decided to trial a treatment for long COVID that might surprise you: a video game.
Just like practicing sports or music, a tough challenge will help you improve. I think I'm doing pretty good.
As you do better, it gets harder.
Yeah.
Then as you do worse, it gets easier. It's very dynamic.
There is even a dose that they prescribe in the trial: 25 minutes a day, 5 days a week, 8 weeks.
Is it going to translate into you being able to do your taxes? Are you going to be able to be organized? Are you going to be able to be driving? And when you stop the game, do all those benefits stop? And that's a good question. I think the literature and the science that has emerged is you don't need to be playing the game for the rest of your life to accrue the benefit. But that is certainly something that critics have raised.
The question is, can it help heal the changes sometimes seen in the brains of long COVID patients, like this? Loss of gray matter in the frontal cortex, tissue damage over here, and an overall shrinking of the brain. None of this is easy, and to be sure, a video game won't be a panacea for Barbara. But at this point, anything seems to help.
How did it help you?
Attention to detail, paying attention, focusing, some memory.
How are you thinking about the future? Are you optimistic?
I take it day by day right now. Because if you try to take it month by month, it's really hard to try to think that far out.
It's almost like retraining the brain after having a stroke, trying to get things back on track. And it's so important when you have so many people who are dealing with this.
Look, one of the things that people with long COVID are dealing with right now is not being believed or people not
Yes.
understanding what they're going through. I remember talking to Senator Tim Kaine a few weeks ago, who is dealing with long COVID, and he just says his nerve endings are on fire half the time. He wakes up at night and he feels this ongoing tingling and pain. And, I don't know if the research is keeping up with the condition that many people are dealing with right now.